Greetings of the day, folks. Today we are going to discuss about Pneumonia Care Bundle. The acronym is COST. If you don't treat a pneumonia patient properly, it will cost us life. So that's an easy way to remember. This is an excerpt from British Thoracic Society from the Pilot Care Bundle project. Okay, you will find it is a free PDF. You can Google it. Okay, so let's start. So in this, the elements were chosen from British Thoracic Society community-acquired pneumonia guidelines. And the focus of the it focuses on most important domains in the management of pneumonia within first 4 hours of admission. So this is because this is where this is the time period where the appropriate management is likely to have a greatest impact on the prognosis. So the mnemonic is COST, C for chest X-ray, O for oxygen assessment, S for severity, that is scoring, and T for timely and appropriate treatment. So the bundle statement 1 is perform a chest X-ray within 4 hours of admission in all patients with suspected community-acquired pneumonia. So if you get a accurate and early diagnosis of COP, it's critical to avoid any inappropriate treatment. In general, only half of the patients initially suspected to have community-acquired pneumonia actually have confirmed COP. On the basis of the assessment of chest X-ray and risk score, antibiotics should be prescribed using correct antibiotic based on local guidelines and correct mode of administration, either oral or IV, depending on severity of the patient conditions. Now, the second statement, the BTS CAP recommendation is that all patients admitted to the hospital with suspected CAP should have X-ray performed as soon as possible to confirm or refute the diagnosis. The objective of any service should be for the X-ray to be performed in time for antibiotics to be administered within 4 hours of presentation to the hospital should the diagnosis of the FCAP be confirmed. Now the bundle statement 2 is we have to assess for oxygen saturation in all the patients admitted with CAP and prescribe supplementary oxygen where appropriate when appropriate according to PTS guidelines. So we do the oxygen assessment with oxygen saturation or ABG, that is arterial blood gas, in accordance with the PTS guidelines. So the bundle statement 3 is we have to record the severity of the illness. It is supported by COST 65 score, which will look. So because this is important because, and also it is widely accepted also because it is it is critical in deciding the site, either like outpatient or inpatient, or the depth of investigations which the patient should be undergoing, or the antibiotic choice. So the COST 65 score is an internationally validated score that assesses the severity for CAP. Let's look at the COST 65 now. So curve 65 is curve 65 is for pneumonia severity. It estimates the mortality of the community acquired pneumonia to help determine inpatient versus outpatient, as I have mentioned. So when to use it? It can be used in emergency department setting to risk stratify a patient's community acquired pneumonia. So it includes points for confusion, blood urea nitrogen, which is in the acute ill elderly patients could be due to severity of factors. So there is another score that is called SOAR. SOAR is for it uses low systolic BP, poor oxygen, that is for O, A for advancing age, and P for R for respiratory rate. So CURB 65 does not assign points for comorbid illness and nursing home residents, as the original study did account for many of these conditions. So CURB 65 may not identify requiring ICU admission as well. Okay. So why to use this? So it is a fast to compute, requires likely already available patient information, and provides an excellent risk stratification of the community acquired pneumonia. It can facilitate better visualization of resources and treatment initiation. So that is in comparison with the pneumonia severity index, CURB 65 offers equal sensitivity of mortality prediction of the due to community acquired pneumonia. Okay, so notably, so CURB 65 has got a 74.6%, has a higher specificity than the Monte severity index. So in Curve 65. C for confusion, it accounts for 1 point. B for BUN, that is blood urea nitrogen, more than the 19 milligrams per deciliter or 7 millimoles per liter. It also accounts for 1 point, and respiratory rate is more than 30, and systolic BP is less than 90, or diastolic BP is less than or equal to 60. And A for age. Okay, curve 65, right? 65 is for age. So all these points account for 1 points. Okay, so if you click on this, so you can see here it is only 1 point. The patient falls into the low risk group, so patient can be considered as an outpatient, can be treated outpatient. Okay, so if the points for the curve 65 score, normally it ranges from 0 to 5. So if it is 0 or 1, there is 1.5% of mortality risk. Patient can be disposed of the outpatient follow-up. If the score is 2, there is 9.2% mortality risk. We must decide whether the patient requires inpatient or observation. This is an ambiguous state. If the score is more than or equal to 3, there is 22% mortality. So patient requires an inpatient admission with consideration for ICU admission of 4 or 5. Okay. So this is the evidence. You can find this in the mdcalc.com. Okay. So let's go back to our present discussion. So this is curve 65. So there is no specific recommendation that the severity should be assessed, as this was taken to be self-evident. The guidelines contain the recommendation that for all patients, curve 65 score should be interpreted in conjunction with clinical judgment. Last but not the least, bundle statement 4. Administer timely, at least less than 4 hours from the presentation, and targeted antibiotics appropriate to the severity of illness. The BTS guidelines offer clear recommendation relating to the timing and type of empiric antibiotics, either single, combination, or IV or PO per oral, stratified according to the disease severity. So the recommendation is that the objective of any survey should be to confirm the diagnosis of pneumonia with X-ray and initiate antibiotic therapy for the majority of the patients with CAP within 4 hours of presentation to the hospital. Let's see a small diagram, that is a driver diagram, which concludes our presentation. So this is to reduce bed days and in-hospital inpatient mortality from CAP. The acronym you must remember is COST. Okay, so C for chest X-ray, that is to be done within 4 hours. O for oxygen, we must recognize we must recognize hypoxia and correct oxygen prescription within 1 hour. And S for severity, that the commonly widely accepted score, that is curve 65 score, should be used. And T for timely management with antibiotics, either single or in combination, based on the severity of the patient's presentation. This concludes our presentation. Thank you very much.